cardiovascular disease across the world is the number one cause of death, and it's much worse in our population for a number of reasons, some of which you can change and some of which you can't change. The things we can change are like, stop smoking, exercise more, have a healthy diet, early screening for diseases such as diabetes, hypertension, bad cholesterol. The things we can't change is when you're getting older, you can't change your age, you can't change your gender. Males are more likely to have cardiovascular disease, and we can't change your ethnicity. Persons of South Asian descent are at much higher risk of cardiovascular disease. But the things that we can change, we have to have programs in place to change. So, for example, if we had to create policies, I believe we should have early screenings done for these chronic diseases. Across the world, people tend to recommend screening at age 40, 45, 50, etc. But I can tell you that what I have seen in just 12 years of practice in Guyana is very astonishing. Let me be specific about that. When I first came back, the average age of the heart attack patient was in the 50s and 60s. Now we're seeing the 30 and 40-year-old, and this is 10 years. It could be that we're recognizing them earlier. We have a lot more healthcare workers who are sensitive and aware of this problem, but it's still frightening that we're having people at this young age coming in with severe cardiovascular disease. And still, 1/3 of people coming in with massive heart attacks to the hospital are now, for the very first time, finding out that they have diabetes. So what it means is that we don't have proper screening. And culturally, we generally have been waiting until we get sick to go to the hospital. So part of the programs that we will be advocating for is early screening. And I believe that the Guyanese population should have screening sometime between the age of 25 to 30.